this week's edition of the Yamhill Leadership Roundtable. Today we have, it's a Happy New Year, everybody. So I am so focused on making sure everybody is in this room. We have with us today Jody Christensen from Regional Solutions and the Governor's Office. She's the Regional Solutions Coordinator, I believe is the title. Yeah? Okay. We have with us Mayor Rachel King from the City of Amity. We have Mayor Linda Watkins from the City of Carlton. We have Shannon Beaucaire, the City Manager for the City of Carlton. We have Kenna West, the City Manager in the City of Willamina. And we have Betsy Emery from Senator Jeff Merkley's office. So welcome, everyone. And special guest Jody today, I've asked her if she can give us an update on the changes in the forecast from OHSU and how that affects OHA, Oregon Health Authority's message and direction to the community. And then the announcement last week, I believe, about at-home test kits that the governor and OHA have secured a contract for and are going to be distributing. So welcome, Jody. Thank you so much for joining us.
Thank you. I'll preface this by saying I work very closely with the Oregon Health Authority, but for technical expertise, I would rely on their website and certainly your local public health. You have a fantastic team there, and rely on sort of the most current information through those sources. When I'm done with my brief conversation, I will put in the chat the link to the Oregon Health Authority. So yes, about 3 weeks ago, I think it was, the governor came on the news and stated that we were expecting a significant increase in hospitalizations and daily case rates based on some modeling that was done by a team of experts with the information that they had at hand in that moment. And so that modeling is it gives projections, but there's more information that they can add as information reveals itself. So they were able to look at the modeling again with some new information, and were able to bring those numbers down. That being said, they're still significant. While it's not as dramatic as the initial numbers, we have case rates that are concerning. We have hospitalization numbers that are concerning. And so the governor has outlined, in partnership with the Oregon Health Authority, several things that should be done over the next 3 or so weeks. And one is a significant information that I think everyone needs to be aware of, is that we want to make sure that 1 million boosters are received by the end of January. This is incredibly important, that people are continuing through their course of vaccinations. It's not just the initial shot or shots, the course of shots, but that we continue to increase our ability to fight the virus through the booster. And so I will just give a shout out to Yamhill County. I had my son in from college, and we were able to do the drive-through that they have at the fairgrounds. It was extremely efficient. I'd bring a book or have something to work on, because the great news is the lines were long, but they went through very, very quickly. We were moving. They had checkpoints where we were filling out information. So you were definitely felt like you were getting through the line, but it was very efficient and effective. So I highly recommend checking the local public health website. They give you both the times that are through the drive-thrus and then those that you can make appointments. So it's a great system, but that's really going to be the best course of action is to be vaccinated and to be boosted. And so we want to make sure that you have that. I think too, Commissioner, it's important that people understand that the 12 million tests that are coming into Oregon, I believe your director for local public health is the best one to know the current information. But in preparing for this, I did learn a few things. So it's actually 6 million kits with 2 tests per kit. So that's good information to have. I know there's been some conversation about how can there be sort of on-hand tests for businesses or others. I don't have an answer to that, Commissioner. You may have, but my understanding is that the kits are going to be first going to local public health authorities, K through 12 schools, and community-based organizations. So access will be through those entities, and I think Yamhill County, I know Polk County and Marion County have very good systems that they're putting in place to have those tests available to people when they're needed. I'm not sure if there's a way that you can sort of, for lack of a better term, kind of stockpile those. I don't think that's the way that they're going to be distributed. I think it is through our health system. So that's actually good news, because those are regular and consistent ways to access the testing. So I think that that's a very good thing. I know that I've said this before with you individually and you as a group, that the governor's priority is that we keep schools open to in-person learning. So I think by having K through 12 be one of the systems that receives the testing, that is good news, because we know it's important to keep our young people in the in-person learning situations. I don't know if there were other specific things, Commissioner, or those on the call. If you had questions, I may or may not be able to answer them, but I'm happy to take them. So if there's something specific that you wanted me to talk about.
Well, Jody, I thank you for just kind of bringing that all to us, and understanding that projections and forecasts of case counts and hospitalizations are going to change, obviously, week to week as we know more. But thank you for sharing all that. I do know also that the Yamhill County Public Health and Director Manfred will be joining us next week with a more detailed update on some of this information. But they also do have some amount of the at-home or the rapid or the antigen test kits that they're able to distribute very carefully to high-risk groups or groups that really do need them, that's separate from the state kind of source. But thank you. Thank you for being part of an organization that's getting test kits out to people, first of all. And then thank you for joining us, and thank you for being in this marathon. But with that, I will open it up for questions or comments from others. And it looks like Councilor Drabkin has unmuted.
Thank you very much. I apologize, I missed the first couple meetings of the call. I was having some login issues, but so if this has already been covered, then my apologies. I'm wondering if you could take a moment, and thank you for being here again today. I'm wondering if we could take a moment to talk about the state adopting the new federal OSHA regulations and what we can kind of anticipate, and what we as smaller cities and municipalities and counties can be thinking about and thinking about needing to expect as some of these new rules roll out. My understanding is the new federal OSHA regulations will be covering anybody that it also qualifies for workman's comp. So for cities and counties, that's pretty expansive. And I'll mute and listen. Thank you.
I appreciate the question, Councilor Drabkin. I will say that I need to go back and find more information to share with you. As you can imagine, there's a lot of moving pieces right now, and I would appreciate the time to be able to go back and provide the most current information for you on that. And I appreciate your patience with me. Thank you.
Yeah, and Councilor Drapkin, at the county, we don't know more than we've been following kind of all along, but we've been prepared essentially since the state mandate came into play for health workers to enact something similar and work with our union representatives on that. So as soon as I learn more too, I will let you know. Mayor King?
Yeah, thank you. So I had a question just regarding the regional hospital capacity and what the talk is there, because we see numbers of how many beds available. And I know, there's 7 regions across the state, but is there a threshold, and is that something that plays into effect as new plans are made?
Thank you, Mayor, for the question. Yes, we're in Region 2. And so statewide, the numbers that we're looking at are, and I think if you receive the daily report from Oregon, the Health Authority, I'm hoping that you receive that. It does outline the number of beds that are available in the different categories, ICU and others. And so the idea is that we want to make sure that we're not exceeding the need for the hospital beds that are available. And right now we're at a very critical point because we do see the numbers are, those beds are less and less available. Right now, the governor does not have the intention to, if you're talking about new types of mandates or changes in sort of the way that business is taking place, we feel, the governor feels that the vaccine and the boosters are the best course of action, and that we keep on that course, and that there's no discussion right now of changing what we're currently doing, and that is the indoor mask mandate is with us, and we're encouraging the boosters and vaccines. I hope that answers your question.
Partially. So she spoke about bolstering the healthcare system and bringing in help that the state needs. And so when I see that our region has no beds at capacity, and part of that issue is staffing, are there plans in place to bring up those numbers and open up more beds if needed? Because we are already at that crucial point.
So I can't speak specifically to the increase of beds, but I do know that the executive order under the emergency declaration was supposed to end on December 31st of last year. She has extended that an additional 6 months, and that gives the governor the capacity to bring in volunteer medical providers to bolster the hospitals. I think we saw that earlier in the year when she deployed you have completely lost the National Guard. Thank you. Yes. So that executive order allows her to be able to be more agile and responsive to do those kinds of things. So I think, Mayor, that's exactly the intent behind the extension, so that she can access additional support staff. Regarding the beds, that would be something I'd have to go back and find out what kinds of plans would be in place for that.
Thank you.
Awesome. Other questions or comments? All right. Well, what Jody says is going once, going twice. Oh, sorry.
I'm just going to end with this. In the entire time that I've been supporting this region in COVID, since March 2020, I've been supporting you from my home. I've not known anyone who's had COVID in my immediate circle, that both a professional circle or a family circle. And this week, I've discovered that there are people who I work with who have entire families that are now have COVID. So this is a highly transmittable variant, and we just need to continue to be diligent. I know that we're tired, and it feels like here's one more, but this is a highly transmittable variant, more so than Delta. And I just want to make sure that everyone is continuing to wear their masks and wash your hands, and be careful about being around large groups. Today I wiped down all my mail when it came into the house. It really kind of shocked me when so many people had announced that they had tested positive for COVID. So I think I will also say that indications are that the tail of this surge will be end of January, first part of February. That's the modeling now. That's what we know today. We'll know more tomorrow, but that's all I have for you. And thank you for the time.
Well, thank you for that very, very sobering ending. And Betsy noted that in the chat that her whole friend group has COVID right now. So yeah, it's definitely with us. And I will note that for folks who admittedly have some level of caution around it, and they're like, well, it's less harmful. I know more people than I really want to who have long COVID from earlier cases that were very mild. And that's not people who were on ventilators for weeks at a time, which is another whole group of people who had the lasting effects of the hospitalization and not necessarily the COVID, like a long COVID. So it's here and it's still with us. And thank you for your work. I will attest that Jody has been working for, almost 2 years now, to try to keep our community safe and the economy alive still, so that we have something to recover on the other side. And doing that balance and tension, I really appreciate. So thank you. And we only have 12 more minutes before I need to shut us down. So I would love to hear from the rest of you here. And I'm actually going to call in Senator Merkley's staffer, Betsy Emery. Betsy, what would you like to tell us from the federal level?
Two things. Yeah, so COVID related, there is a map. I think Jody just spoke to this, but I wasn't present, but there is, in addition to the governor's order for 6/12 million tests, there is another massive order of federal shipment, I think, of tests that are also coming in. So, and those are the ones that are being distributed to different public health authorities and rural places and all kinds of stuff, with a keen focus on equity there. So I should be getting guidance within the next 2 weeks about kind of what that list looks like in terms of where they're going. So if you haven't heard from me, or if you haven't heard from your county public health folk, poke me and I'll poke DC. The other thing is that Biden announced with his Omicron plan, I think before the holidays, that there would be an insurance reimbursement option for the at-home test. That is live starting January 1st. So save your receipts and you can go through the self-billing process with your insurance, which is, not always the easiest process, but it is a process that is available to you. I'll have steps and more guidance for what that process looks like on the 15th. From DC. So those are two COVID related things. And then the other thing I'll flag, in addition to the infrastructure guidance having come out, if you want to talk through any opportunities there, feel free to reach out. And then the last thing I'll flag is that Senator Merkley is in town hall season right now. And we try to host all of our town halls in the months of January and February. Since I'm the newest staffer on the team, they're pushing my counties till February. So I'll be in touch as soon as I know dates. They're all going to be virtual. And so our town hall process is basically that there's a 30-minute meet and greet for elected officials. So anyone who wants to show up and talk to the senator about an issue, feel free. And you'll get a personalized invite to that from me. Then there's the hour-long meet and greet, or town hall, kind of traditional town hall as well. So that's more open to anyone in the community. So yeah, I don't have dates yet, but you'll be getting invited as soon as I do. And I'm happy to answer any questions about the federal government.
And then congressionally directed spending overview January 10th.
Oh yeah, yep. Fritz and I are finalizing our information for that too.
And I sent it out. I think I sent an email out to people, but I will do it again. Don't worry.
Yeah, and then I know a number of, Bo says hi, a number of individuals throughout the county have contacted me saying they can't make it. So I do want to make sure that we send out that YouTube link too to everyone and kind of highlight that that's what that link is.
Perfect. That sounds great. And then are there other questions for Betsy? All right. Thank you very much, Betsy. Welcome back. All right, Mayor King, what would you like to share with people Amity and here?
Yeah, staying on the COVID topic, I just saw before I popped on that at the fairgrounds testing, they have rapid test available now. So I don't know the logistics, if you can get both, if you can get one to take with you, but as of 10 minutes ago, they said they had those available. So that's a good start, and it sounds like a supply is coming, so that will continue to be more and more of an option. We'll be able to get it out through sources. And then for Amity, not much, a lot of rain, a lot of snow. We've all dealt with that. Council is going to vote to accept our $2 million grant award from Representative Neerman tomorrow night. Most exciting news. And that's about it for today. I'll let someone else have a chance.
That's great. Hooray. And I will say that following the snow and lots of rain and then lots of warm rain coming, the Yamhill is going to be very full. So be careful out there in the Amity. It doesn't look like it's going to be to the levels that were predicted, which would have put it at the second highest river level in McMinnville on record. So it's not going to get there so far as we know now. Okay, great. Mayor Watkins, I'd love to hear from you then. What would you like to share with people?
Let me close down my video so I can. I told my husband before the end of the month, we need to get, before the end of the month, we need to get improved internet for this computer. I don't know. We just had a really nice Christmas season. I think everything went pretty well, smoothly. Mayor King, thank you for your comments and compliments on our Christmas decorations. I hope everybody did get a chance to maybe run over and take a look. It was our Christmas and Carlton committee really did an amazing job. So we're back. First council meeting of the year is starting up this evening, so we'll see how that goes. It's going to be pretty short and just catching up with things. We watched the river coming up yesterday and wondered if we were going to be flooded in by today, but fortunately the rain stopped, so that let us off the hook there. Looking forward to the January the 10th meeting, and certainly in February to visiting with the Senator Merkley. So yeah, right now we're getting ready to do a work session this weekend to discuss our new city civic building, which will include police station, some kind of emergency services, and also public rooms, as well as just our administrative and our regular buildings. So that's been a long process, and each time we have a meeting, we cross our fingers that something doesn't happen to stop it up again. So that's about where we are right now. We're just moving into the new year. Thanks.
Great, thank you, Mayor. And Jody, Mayor Watkins and Betsy are talking about how the federal government might be able to help fund some of this, because that was probably on your mind.
Yeah. Actually, we are going to be looking at, excuse me, my throat, every source of funding that we can possibly come up with or think about. I think we've been doing some exploring. Shannon is a great researcher and has been really looking for alternatives. one of the things that we have tried to make clear to the citizens in town was that we're not going to just raise taxes to pay for the building. It's not fair to anybody, but we really do need that building. And so anything we can find for, you know, even if it's a grant for one room for a library, we're happy to get that, whatever we can get.
So Mayor, my
Yes, ma'am.
thought is, as you work through that process, call in the regional solutions team. We can have a quick meeting, or not so quick meeting, if you like, but learning about the project, the components of the project, and also where you are in that process will be extremely helpful for the team, because once they know about the project, then they can go back and look for potential resources, technical support. So we want to make sure that you know that's available to you.
Thank you. Yeah, this Saturday, we're going to have a work session with the city council and the architects. And at that time, we will have, by the time we get done with that, we hope we will have a little more firm and I guess solid idea of what we're going to be looking at and what's going to be in it and how it's going to look. And then I think at that point, we're going to be able to be a little more able to reach out, instead of right now, we'd reach out and say, well, we want this building and we want this stuff in it, but we think it's going to cost about this much, but we're not really sure. So, you know, we'll have a little more concrete information about it. And the other thing that I forgot that's happening is ODOT has restarted their program, number one, to do, to come in and just do some of the ADA ramps that they need to do, but also we are starting to discuss again the whole Highway 47 reroute project, which went on. It was going forward and then it went on hold, and now it's going forward again. We have 2 new project managers. So the people that we were dealing with over the last year and a half have moved on to other places. Well, Casey, John left, and Christine is also moving back to her prior position. So we're kind of having to start a little bit once again from the ground up with them, because we had been pretty well able to get through to the prior team that our community really needs to be involved with these decisions and these plans. And we need to have the people on the ground in the community learning and discussing about them, not just being told what they're going to look like. So it's going to be, we're starting to have those conversations again. So those are the two big things I think right now on our plate. Those and of course, the sewer and the, all the other things that we carried over from last year. So
Totally.
Thank you, Jody, and we will definitely, I'm sure, be in touch with you.
All right. Well, thank you, Mayor. Yeah, thank you, Jody. I felt like it was important to make sure that you connected on that too. Councillor Drabkin, do you have anything you'd like to share before we wrap up for this brief one?
Knowing that the time is limited today, I will take a back seat. There's nothing pressing to share with the group. Thank you.
Okay, that sounds good. City Manager West, is there anything you'd like to share from the city of Willamina?
Super quick. Casey, I just want you to know we have a Cottage Buster going forward. Yeah, I'm so excited. And it's our really good developer that's doing it. And Jody, I want you to know that that really good developer is here because of the opportunity zone that we set up all those years ago. Is that not astounding? Those things we do that they come to fruition. It's amazing. I love it. So that's it. Those 2 cool things.
That's so awesome. It's like laying, building that environment that you all did a long time ago, is bearing fruit now. So way to go. Well, I just wanted to make sure that people knew here on the call that the water and sewer grants have been evaluated and scored, and we'll be discussing those at our next meeting. And then the next two things will be moving out into the world in terms of funding our broadband. And then approving a contract to work with the early learning division to direct funding out for childcare, because we felt like it was early learning division here in the county, and Jen Richter and her staff are much more knowledgeable about how to effectively use the money than we are. And I'm super glad that my colleagues recognize that too. So we'll be discussing those and approving contracts for them very soon. The one for broadband is actually to get a consultant on board who can develop a master plan for the county so that we can have a long-term vision of how to improve internet access across the county, rather than just throwing money at one thing or another and hoping that it helps. So stay tuned for that. All right, any closing thoughts for today? And it's good to see all of you again. All right, thank you very much. And we will see you next week. Director Manfred will be here to talk about public health and the coronavirus surge. Until then, wear a mask, get vaccinated, stay home if you're sick, is what Mayor King reminds us.